and to my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Tuesday. I wanted to acknowledge that we're on the territory of the Lekwungen-speaking people, the Songhees, and the Esquimalt First Nations. As I noted yesterday, I wanted to thank everyone who took part in yesterday's town halls hosted by MLAs George Chow and Teresa Watt. And I wanted to also thank CEO Mary Ackenhusen of Vancouver Coastal Health and Chief Medical Health Officer Dr. Patricia Daly. More than 10,000 viewers and more than 30 questions from the audience, so we want to thank everyone who took part in that. On Thursday, Northern Health will host its virtual town hall with MLAs Jennifer Rice and Coralie Oakes as hosts, and Northern Health CEO Kathy Ulrich and Chief Medical Health Officer Dr. Rena Fumerton will field questions, and you can watch that on the Government of BC's Facebook page or the Province of BC's YouTube channel. I also want to note that earlier this afternoon, the Premier led a meeting again with community leaders from across the province. Dr. Henry and myself were there, and it was an excellent session. More than 100 leaders took part in the session, and it went very well, and we're very appreciative to all of them, not just for participating in the session today, but for all they've done to assist and support their congregations during this period. And with that, I'm happy to introduce Dr. Bonnie Henry.
Thank you, and good afternoon. So this is our COVID-19 update for May 26. We have had 11 new people test positive for COVID-19 in BC today, bringing our total to 2,541. That includes 897 people in Vancouver Coastal Health, 1,261 people in the Fraser Health Region, 127 people in the Vancouver Island Health Region, 194 people in the Interior Health Region, and 62 people in Northern Health. We have no new healthcare facility outbreaks right now, and we're really pleased to say that the Richmond Hospital outbreak has now been declared over. So that leaves us with 15 active outbreaks in our healthcare system, 14 in long-term care and 1 in acute care. And also on a positive note, we've not had any new resident cases in those outbreaks in the last day, on just a single increase in a staff case. Bringing our total to 543 people in the healthcare system. You will note that that is actually 2 more individuals than 210 staff people, and that was a data correction, but it was previous cases, so not new cases. We also have no new community outbreaks and are continuing to monitor and to support the number of community outbreaks that we have ongoing in the community now. So that leaves us with 258 active cases right now. Of those, 37 people are in hospital and 7 of those are in critical care or ICU. And I'm extremely pleased that today, for the first time in a while, we've had no new deaths from COVID-19 in British Columbia. And we've had 2,122 people who have tested positive who are now fully recovered. So that is good news for us. We have a few more days left. The survey that we have been to gather your feedback about your experiences of the past few weeks and help direct our responses going forward. So it's Your Story, Our Future study. Over 321,000 people have taken it so far, but we do want to hear from people, particularly people in the north, people in smaller communities, and elderly people. And if there's people out there who don't have access to technology, please assist them in helping to complete that survey. I know now that we are in phase 2, there was a lot to look forward to, and slowly and thoughtfully we are increasing our activities. And I understand that with this transition, there comes a lot of anxiety and some uncertainty and some frustration. And for some, that means frustration that we are moving too slowly, and for others, frustration that we are moving too fast. It is a balance, and I know that is very hard to achieve. And it has been a learning experience for all of us in the past week, trying to find that right balance. Today we were able to report, as I said, no new deaths for the first time in quite a few weeks. And we want to be able to do this every day, so no more families have to deal with the loss of somebody they love. So I encourage everybody to continue to show patience and understanding and have confidence that what we are doing is the best that we can to protect our families and our communities. And that means that it might be slower than many people want, and it might be faster than others. We know as well that COVID-19 is in all of our communities, and we've talked about the people who have tested positive, but there are also the close contacts that we continue to monitor in public health. And right now, our focus is on that. It's on ensuring that every case that arises in our community, we can follow, we can test, we can trace the people they've been in contact with, and we can track those people over the period of the incubation period to make sure that if they do develop symptoms, they have access to the health care they need. And for those who are sick, we do monitor as well every single day to make sure that they have what they need and are able to access healthcare services safely if they need them. From what we have learned and what we continue to learn about this virus, the measures we have in place are the best things we can do to slow the spread. That's why we are trying to have a series of measures that work in our community that we can sustain over time. Everyone in BC has put in the effort over the past number of weeks and months now to flatten our curve, to keep it as low as we can get. And we're now 1 week into phase 2 with more people out, more businesses open. We cannot go back to our pre-COVID days. We need to find that balance that allows us to get things moving, to have increased contact, social contact and social connection, but not to go back to the place where this virus can take off and infect a large number of people in a short period of time. As we slowly make this transition, we can spend more time with others. We may see an increase in cases, and that is what we in public health are preparing for, and why we are making some of the restrictions that we have in place around numbers of people that can gather, around the importance of making sure that if we are ill, we stay home, around the importance of maintaining our safe physical distance from each other, the importance of our continuing adherence to hand hygiene, and in some situations, adding that extra layer of wearing a non-medical mask. Small numbers and knowing who you are with helps us make sure that we can continue that public health activity to keep our communities safe. As we go forward, our new normal is different, and it will be for some time, and we need to keep within our limits and keep up what we know works. We all have a role to play, and we've seen that that can be successful here in BC, and it relies on our ongoing shared commitment and effort. Remember what I've been saying, the bigger spaces and fewer faces. That helps us all, and it keeps us all safe. But also remember to show that compassion and care that we have for each other as we're going through the anxieties of this transition. To continue to be kind and to be calm and to be safe.
Thank you very much, Dr. Henry, and it is something which we're really grateful not to have to announce any new deaths in British Columbia from COVID-19 today. We acknowledge the 161 people who have passed away and their families and the struggles that they continue to be going through as they grieve for their lost siblings and fathers and mothers and grandparents and friends and family. But we're obviously pleased that there are no deaths to report today and only 11 new cases of COVID-19 in BC. So 37 continue to be in hospital and 7 in critical care. A note that about 69%, our occupancy rate is up to about 69% in BC hospitals across the board, still around 50% in critical care, and that yesterday 5,234 people visited emergency rooms across the province, which is one of our higher totals since March, and I see that generally as a good sign. Every Tuesday I've reported on PPE that we've received over the last week, and I just want to recap where we've been cumulatively from the previous announcements since the beginning of April. We've obtained approximately 4 million N95 respirators. 63,700 of these are from the federal government's bulk procurement, that's 1.6%. Approximately 4,250,000 surgical masks, 146,800 of these are from the federal government's bulk procurement, that's 3.4%. Over 1,250,000 pieces of eye protection, including goggles and face shields. 381,000 of these face shields are from the federal government's bulk procurement. That's 30.53%. Approximately 26 million pairs of gloves. 440,000 of these are from the federal government's bulk procurement, or 1.7%, and approximately 1.3 million gowns. Today, I can tell you that we've received since last Tuesday 151,772 additional N95 respirators, 255,600 surgical masks, 1,380,700 pairs of gloves, 7,405 pieces of eye protection, and 233,250 gowns. As always, any product that we receive that isn't from a previous trusted vendor will be subject to assessment and testing before it gets into the health system. This includes masks and respirators received from the federal government and from donations as well. On the topic of PPE testing, I'd also like to mention that we've recently received a new machine that we'll be able to use to test masks and respirators right here in BC. The machine, called the TS18310A, is used by leading filter manufacturers and test centers around the world. It will be used here in BC to test the filter efficiency and function of respiratory masks and compute results so we can ensure that any masks and respirators that we procure from new international manufacturers are in fact safe and effective from a filtration perspective. And we're obviously very appreciative to add this to our efforts to secure PPE and to put it into use in BC. In closing, I wanted to go back to a point that Dr. Henry has made repeatedly and effectively over the many months that all of us have been meeting up most afternoons through COVID-19 updates. BC's COVID-19 response is just that. It's our response. It's our Made in BC response to keep us safe in a global pandemic, in our own pandemic that we're dealing with in BC. It's a response that saw British Columbia come early to its fight. It's a response which, through our effort and skill and even some early good luck, saw us bend the curve and not the rules to get us where we are today. It's a response that saw all of us, each one of us, make a difference and build our own future. The past few days have offered some images from other jurisdictions where efforts to stop the spread appear to have paused in some places, where the sacrifices made to keep people safe appear for the moment to be forgotten. Each of us can see these images, and in thinking about BC and how much longer for further easing of restrictions, momentarily wonder, why bother? Why keep using the skills we've learned to stop the spread when these images can make it seem like others have drifted? But I'd ask everyone who may have had this thought not to give in to it. I'd ask everyone to remember the things that should give us strength and the confidence to keep doing what we're doing, to build a future, to build our future in our BC COVID-19 effort. I'd ask everyone to remember that not all jurisdictions started their pandemic fight as early as BC did, but by staying 100% committed to our effort and by remaining 100% all in our BC COVID-19 response, we find ourselves choosing social, surgical, and economic renewal, not being forced into it. While we watch how others manage their pandemic response, the lead to follow right now is our own. The shortest distance between where we are in BC and where we all want to be is to follow the guidelines Dr. Henry has provided, using the skills she and other people in public health have taught us by staying apart and working together. This is our BC pandemic, our BC effort, and our BC path to safety. The lead to follow is ours, and we continue to look to each other and count on each other for the leadership that has brought us together and taken us this far. Aujourd'hui, nous annonçons 11 nouveaux cas de COVID-19 en Colombie-Britannique pour un total de 2541 cas. il y a eu aucun nouveau décès lié au COVID-19 dans les dernières 24 heures et je m'en réjouis. Il y a un total de 161 décès en Colombie-Britannique et nous offrons nos condoléances à tous ceux qui ont perdu leurs proches pendant cette pandémie. Chaque région de santé de la Colombie-Britannique compte des patients atteints de COVID-19. 897 se trouvent à Vancouver Coastal, 1261 à Fraser, 127 sur l'île de Vancouver, 194 dans l'intérieur et 62 au nord. Il y a actuellement 37 personnes hospitalisées avec COVID-19 en Colombie-Britannique. Thank you very much. Merci beaucoup. Happy to take your questions.
Thank you. As a reminder to everybody on the phone, please press *1 to enter the queue. You will be limited to one question. I would also ask that you please take your phones off mute. You will not be audible till I call your name. First question today is from Richard Zisman, Global News.
Dr. Henry, I'm not sure if you saw, but NHL Commissioner Gary Bettman just made an announcement about the return of the hockey season. And one of the things that was mentioned were hub cities, of which we know Vancouver is a candidate. One of the challenges for Vancouver, no doubt, is the border. And so to you, would you make a suggestion that NHL players be designed as essential workers and be allowed to come to Vancouver from outside of the country? And second, would you think of any consideration of not requiring the 14-day quarantine for NHL personnel coming into Vancouver?
Yeah, so we were quite excited to hear that Vancouver apparently is still in the running, which is good news. I would love to have hockey, but we have been very clear, and the Premier has been very clear, that we're not bending the rules in any way that would put what we have achieved here in BC at risk. So I've yet to see a plan. I'm happy to see what we can do, but we won't be changing rules that would not, that would put anybody at risk or would undo the good work that we've done here so far in BC.
Next question is from Tanya Fletcher, CBC.
Oh, hi, Dr. Henry and Minister Dix. Following up on yesterday's discussions about visitations at long-term care homes, twofold here. You said yesterday there's no timeline for allowing family members to visit loved ones. We've seen frustrations that no exemptions are in the works or appear to be, that there's no timeline being made. They've put forward some ideas, like why not set up patios for distant visits with plexiglass, maybe have a special room that's cleaned before and after so residents could see their family. Maybe a member could mask up and take their elderly loved one out for an outdoor walk. And then secondly to that, a retirement company has built these prefabricated family meetup pods to be located near facilities to allow loved ones to visit. Is that Dr. Bonnie Henry approved?
Yeah, I've not heard about the prefab ones, but I don't want to give the impression that we aren't thinking of this, and the timeline really is as short as we possibly can. So yes, there are facilities across the province are looking at how they can do this. We're coming up with guidance for them. The health authorities are working on this and have been for some time. And we need to ensure that we find that balance with everything else. So please don't think because we couldn't put a specific date on what we're talking about that there's no timeline on the horizon. And I know some facilities are looking at, particularly for people in the facility who are more mobile and able to get out. There has been ability for some people to have distance visits outside and for people to get that much needed fresh air, but it varies so much. Of people and of course the outbreaks that we continue to have. So the challenge really is to ensure that we protect the entire community in a way that does the best that we can. So I want this as much as anybody else does as soon as we can. And the numbers we see today are very hopeful. But we also can see what happens. What's that? Yeah. The other thing we know, and again today we saw this in Ontario and Quebec, that it can be so devastating. So we do have to find that balance.
Oui, juste en français pour dire que nous prenons bien entendu au sérieux les préoccupations de tout le monde, moi, et y compris moi-même, sur cette question. Mais ce dont il s'agit, franchement, c'est la protection de la vie des gens. Il n'y a pas de gens décédés de COVID-19 aujourd'hui, mais hier, il y en avait 4. Dans ces circonstances à une facilité. Et donc, ça reste toujours une difficulté pour tout le monde. Donc, on travaille là-dessus, bien entendu, mais on voit que ce soit au Québec, que ce soit en Ontario, ce qui peut se passer pour des gens vulnérables de COVID-19. Et il faut agir dans tous les cas pour les protéger à l'heure actuelle.
Next question is from Marcella Bernardo, News 1130.
Thank you, Dr. Henry. I was hoping to ask you if schools have the sanitation supplies and cleaning staff that they need in place to ensure that high-touch areas are going to be cleaned to the extent that they're needed when schools open up again next week.
This is something obviously that the Ministry of Education would be more on top of than I am, but yes, you know, those are the requirements that we've been discussing with them. I know there was enhanced cleaning that had been started prior to the suspension of in-classroom schooling. Prior to March break. So it is absolutely my expectation, and I know school districts and individual schools are working very hard to ensure that they do have those in place. And so I expect there will be a change from what people have seen in the past.
Next question is from Amanda Hoskud, the Tyee.
Hi, hello, sorry about that. Hi, Dr. Henry. My question is about, I understand you were recently honored by the Gitxsan Nation, and I was wondering if you had any comment on that and if you had any plans to visit the territory once it's safe to do so.
I am so honored. And yes, I was bestowed a name. I was adopted by the Gitxsan Nation. We had a lovely ceremony by Zoom on Friday, and I will try and pronounce my name, Gayatsa Diep, Gayatsa Diep, which is one who is calm among us. So I was very honored and flattered to receive this name, and I absolutely will come and visit, and I have committed to doing that as soon as we are able to, and I'm invited in when the nation feels it's safe for that to happen.
Next question is from Glenn Korstrom, Business in Vancouver.
Hello. Can you hear me?
Glenn, can you hear us?
Sorry, I had an incoming call and it blocked it. I was wondering about the situation in prisons, and because there was one inmate in Matsqui who got transferred to Mountain. Just wondered if there's any follow-up on that, any clarity on how that happened, and on the Mountain Institution outbreak, that is, or the Mission Institution, that is completely over, right?
So there's a couple of things. First, around Mission, there have been no new cases for I'm not sure exactly the number of days, but we're close to the full incubation period. But we don't declare an outbreak over until we've had no new cases for 2 incubation periods. That gives a period of time in case somebody was incubating at the very end of it and was an unrecognized case. But I am confident with measures that we have in place now that Mission will be able to get through that period without, so I do expect we will have no further cases there. That should be coming up in the coming days, and I can get the date for that. In terms of the second outbreak, yes, we reported on this last week. There was an individual who had been at Matsqui and transferred to Mountain and had developed symptoms and tested positive. The investigation is ongoing about where he may have acquired this infection. on, and he had been in a number of other institutions, including a couple of provincial correctional facilities. So there is a coordinated response going on, and those who had any close contact with them have been identified. The majority of them, I know, a number of them have been tested, people who had symptoms. As of yesterday, when I got the last report, there was a single correctional officer who also tested positive, who had been in contact, and so the investigation on that is ongoing. I will say that having learned, I believe, all of us from what happened at Mission, this investigation has been much smoother, much more well coordinated. The infection control precautions have been implemented very swiftly, and I'm confident that we will not get that broad transmission that we unfortunately saw in Mission.
Next question is from Brishti Basu, Victoria Buzz.
Hi, Dr. Henry. My question is a follow-up from a previous one you just answered about the cleaning protocols at schools in BC. I've heard some concerns about the lack of requirement for masks in schools, and I was wondering if you can provide an update on whether or not you see yourself requiring people, especially staff and older students, to wear non-medical masks at schools.
Yeah, no, we don't see non-medical masks as being required on an ongoing basis in that setting. They are optional for people who feel that it's an extra layer that they want to do to protect others from their droplets. But as we know, the other measures that we have in place are the most important ones. So in the school setting, the really important things that we're looking at are smaller numbers of students who stay together so they're not mixing through the day, staggering times to come in and leave, making sure that they can physically distance, and for the younger children, making sure that it's about not touching each other, hand hygiene on a regular basis, all of those things that we know are effective, and those are the things that we're focusing on. We know that there are some people who are not able to wear a non-medical mask, whether for medical reasons or for reasons of disability, for example, where it may be a challenge to put on or take off a mask. So they are an extra tool that can be layered on above other things as well, but it is not it's not something that we would require, and we've talked about this before. It's something that's for short-term use, for when you can't maintain your safe physical distancing, or where there's not barriers in place to protect you. So we're not requiring, and I don't see us requiring non-medical masks in a school setting. And we've been, of course, learning from other jurisdictions around the world where schools have opened, and this is in keeping with what we've seen in other places as well.
Lisa Cordasco, CHLY.
Thank you. Good afternoon. Dr. Henry, you had mentioned in your comments that COVID-19 is everywhere in the province. But in the Island Health Region, maybe you could expand on that, because we've had one active case in hospital for a couple of weeks now and no new cases. So some people may be wondering, well, what do you mean by it's still in the community?
Yeah, I think as we're seeing the numbers decrease, we can all be slightly reassured, and particularly the fact that we're testing quite broadly again. But we know that this has been transmitted in the communities, and sometimes it is very challenging to know where it came from. So we're not out of the woods yet in terms of the fact that we've had people who've returned from traveling. We've had close contacts of people who have tested positive, including here in various communities on the island. One of the numbers that I've talked about is the number of contacts that we've traced in public health, and that's in the tens of thousands. So the number of people who test positive is a small subset of the people who have been affected by this virus across the province. So yes, we need to be careful right now, because we are still seeing outbreaks pop up in places that we may not expect them, and the poultry outbreaks, the outbreaks in the food processing facilities. We know that there's both essential travel and movement of people across the province, and so we need to be mindful of that, and it's not the time yet where we can start thinking that we are safe in any community. We need to continue to take, all of us, the measures to try and reduce our contacts with large numbers of people, because that's when we know that the virus can be still here. And the reality is we know that people can be asymptomatic or early on in their illness may not recognize their symptoms, and it can be transmitted to others during that period of time. So we're in that transition time right now where there's still remnants of this virus circulating between people, and we may not always know where it is. And we are seeing that with the community outbreaks that are popping up.
Sandy Hall, CFX 1070.
Thank you. I am curious if you've heard about this new survey that suggests that half of Canadians think the government is deliberately withholding information about COVID-19. 47% are British Columbians. So can you maybe address that?
So 47% of British Columbians think we're withholding information, or the federal government, or I'm not familiar with the survey, but we've tried to be as open as we can. All of the numbers that I know you have, we'll be presenting again next week. We've talked about ages of people. We've talked about the community impacts of this. We've talked about where outbreaks are. I will say, and I'll say it, we've said it from the beginning, there was a period of time where there were many people who had returned from travel where we said we didn't have the capacity to test, and we didn't want people who were ill to leave their home to have to go to a facility to be tested and various things like that. So we do know that there are more people who have had this illness in the province than the people who test positive. And I talk about this every day, that we've had 11 new people who have tested positive. We also know that that sometimes we don't need to test people. For example, in a family unit, if somebody is sick with this and has tested positive, and somebody else in the family gets compatible symptoms, there may be reasons why they don't want to go in to get a test, and they have a mild illness and they're isolated at home, and we're following them. And we call those epidemiologically linked cases, and I've talked about this before. So yes, there is more illness out there that we have not had a person test positive for. And one of the reasons why we have been actively working on validating a serology test, because that's a good way of helping us understand how many people, what percentage of the community of our population has actually been affected by this. And we also know, as we've learned from this virus, that people can have mild enough illness that they may not even recognize it in themselves. So we are starting our serology testing strategy. We've been, the lab has been very busy, the BC CDC lab, and working with the public health labs across the country to find a test that has enough sensitivity and specificity, which means it truly can tell if you have the illness, if you have the antibodies, and it can truly tell when you don't have the antibodies. And the testing on that, the validation part has started, so we're hopeful that we'll be able to do some broad testing in the community very soon. Part of our survey is the option to be part of serology testing, and I know at least 200,000 of the 300,000 people who've taken the survey so far have ticked that box. So we will have lots of people who we can test when we have a good serology test.
See, I'm always hesitant to answer questions on polling, but I would say this, that we have national polls. There's a BC subset of those polls, and it'd be very interesting to know what N equals in that case. But what we've tried to do in this case, systematically, we're the first province to provide and say what our modeling was, which provided everybody with an understanding, I think, of what we needed to do together. And then we did it again, and we've done it again, and we're going to provide again more modeling next week to let everybody in BC see what we see. That's why there's been 18 weeks since I think our first briefing, which should become daily briefings or virtually daily briefings to the public, either written or here from Dr. Henry or Dr. Henry and myself. So I think all we can do is ensure that people have access to that information. But the results that I like to see are the ones that we've seen, which is a decline in hospitalizations, a decline in people in critical care, and a decline in the active cases. And all of those are the things that we've seen, and those are all good things. That shouldn't have us let up or be any less committed to this cause together. But I think those are the things we like to see when British Columbians were asked to contribute to this cause. They contributed, and I'm so proud of them, and I think that reflects better than some subset of some national poll might.
We have time for one more question. For any reporter,
We do post the information on the BC CDC website every day. There's a dashboard there that gives you much more detail about some of the stats that we present here. So I would encourage people to have a look at that as well.
we have time for one more question. For any reporters that didn't get to ask a question today, there will be a statement released later this afternoon. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the provincial health officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Keith Baldry, Global News.
Hi, Dr. Henry, Minister Dix. Just got a note from someone who said on the call with the faith leaders today, they were informed that overnight camps for kids were going to be either not allowed this summer or strongly discouraged. Just wonder if you can confirm that or at least address that issue.
Yes, and I thought I had said this before. We've had some discussions both nationally and with the public health community around, what are the things that we think are reasonable in terms of summer camps. So we will be encouraging people to focus on day camps. There's not a situation that we can see this summer where overnight camps for youth, for student school-age kids can be done in a way that would prevent transmission of this virus. And the other issues that we're seeing around many of these camps are in more remote areas where it can be a challenge to access health care, or there are concerns, of course, from some communities that it could be children coming from many different areas and having effects on their small communities. So overnight camps for school-age children will not be something that will be happening this summer in BC, and I can say my colleagues across the country and in the US as well, that's the same case.
That's all the time we have for today. Thank you.